Hello, my name is Marie Contreras and I am the proud owner of Marie C. Pet Care. Nothing is more important than my family, and my pets are part of the family in my house. For the last 5 years, I have dedicated myself to the world of pet care because I am a pet lover at heart. I consider myself an environmentalist, an animal rights activist, and a staunch supporter of the scientific research behind proper animal care and welfare. My videos focus on pet care and tips for having healthy and happy pets. I hope you stick around and enjoy what I have created for you today.
Collapsed trachea in dogs, diagnosis, and treatment, a complete explanation. Some health conditions in dogs can be quite serious, and a collapsed trachea is one of them. From the first diagnosis, there will be changes to be made for both you and your dog, but all for the better. Your early actions can potentially delay the onset of this condition, and they could certainly reduce or eliminate most of the symptoms once diagnosed. What actually causes collapsing trachea in dogs? What is a trachea and what causes it to collapse? In all mammals, the trachea is the windpipe. The tube leads from your throat into your lungs. It is basically a flexible, sturdy tube of cartilage rings allowing the oxygen you breathe in to move to and fill up both sides of your lungs. It has to be held open with these solid rings because breathing changes the pressure in your body. When you breathe in, the pressure in your lungs drops, as your diaphragm pulls down, and pulls the air in. The opposite occurs when you breathe out. Therefore, if the trachea isn't held open properly, because these rings have become weakened or damaged, it gets sucked together, flattening this tube and making it difficult to breathe. In dogs, it mainly occurs around 6 to 7 years old, even though it may have been present at birth, congenital. Therefore, aging is often considered to be a factor in the disease's progression. Things such as collars used during leash training and incorrect use of retractable leashes are all believed to be some of the main external factors in bringing forward the onset of this condition in susceptible dogs. In mild and early cases, the trachea only flattens a small amount, and virtually all the air still moves to the lungs. In more severe cases, the tube's diameter can be reduced by more than 50% and disastrously affect how much oxygen gets to the lungs. Obviously, this can have serious consequences for your dog. It is not really known why these cartilage rings become weaker, although many things are suspected. It could be genetic, as it is widespread in toy breeds, including Chihuahuas, Pugs and Poms, with up to 2/3 of Yorkshire Terriers cases. It could be nutritional, triggered by allergies, or a result of other health issues. It could, of course, simply be multifactorial, and no one reason alone triggers it. One of my small clients, a toy Chihuahua, was recently diagnosed with this condition, and she has always walked with a harness, never a collar or retractable leash. She is also on the thin side. So, genetics definitely plays a part. If you find that your dog looks exhausted for no reason or is obviously struggling to breathe, this is a medical emergency. Whatever the cause, veterinary attention must be sought. What are the symptoms of a collapsing trachea? As you would imagine, your dog will display outward and obvious symptoms if they are having trouble breathing. The most noticeable in the early stages is a cough or a whistle. Obviously, just the odd cough or whistle could be nothing serious, we all do it. Anything that would affect their ability to breathe normally could trigger the symptoms. However, as the disease progresses, the cough becomes more distinctive. Because of the way the airway constricts, it creates a sort of goose-like honking sound. Something very different from a normal cough. Unmistakable. The body is designed to react to things to keep itself safe, even if these can sometimes make us feel worse. So if your dog's throat or lungs are exposed to irritants, feel overworked, or are diseased, it is more likely to react negatively. This results in a variety of additional symptoms, including but not limited to, labored breathing, exercise intolerance, fainting, weakness, and blue gums. All of these are related to reduced levels of oxygen to the body and brain. How do you diagnose a collapsing trachea? Obviously, the honking cough is a good indicator of a collapsed trachea, but this condition will need to be properly diagnosed by a veterinarian. It is usually graded into 4 worsening levels depending on the amount of airflow still reaching the body. Grade 1 is very mild, only 25% loss of diameter, through to grade 4, where there is up to a 90% reduction of breathable width. There are several ways your vet can diagnose the severity, and the most common is with fluoroscopy, a moving X-ray. This allows the trachea to be seen in action. However, along with endoscopy, the breathing isn't natural, so allowances need to be made. Radiography of the chest and airways is also used depending on any other health issues either diagnosed or suspected. Obviously, older dogs or those with pre-existing illnesses are at more risk with certain treatments. The condition isn't limited to either male or female dogs or only in certain breeds, so there is no other way to diagnose this for sure. This isn't a condition to be ignored or home treated, though, due to its lifelong requirements. It does have effective treatments and aftercare, though, so the sooner it is diagnosed, the better. What is the treatment for a collapsing trachea in dogs? A collapsed trachea can't be cured, but there are many medications and treatments to make your dog's breathing easier. There is even a surgical option in extreme cases, but this is avoidable if medical advice is taken seriously. You can manage this condition very easily yourself. Once diagnosed, treatment will follow the same path: conservative management. This means conserving what health your dog already has and returning other conditions to as near to normal as possible. Therapeutic medications can help treat the symptoms, such as cough suppressants, steroids, and bronchodilators. Things to stop the windpipe from reacting so badly to irritants or other external factors. This will mean that the dog is in less discomfort or distress as a starting point. Then they will look at diagnosing and treating any other linked health conditions such as lung disease, heart issues, and liver complaints. This should start to reduce the appearance of symptoms. Things then move on to treat other issues, such as dental disease, something long believed to be linked to a multitude of medical conditions and so easily resolved. Obesity can also affect your dog's ability to tolerate respiratory and heart conditions. Losing weight, and ideally being slightly underweight, will reduce symptoms considerably. However, if the condition is already quite serious, is progressing faster than you can manage, or is endangering the life of your dog, then surgery is an option. There are two types of surgery used, but one is the least intrusive and safer of the two: intraluminal stenting. This involves a small, sturdy frame being inserted inside the trachea to hold it open. It is the same shape and size as the windpipe itself and prevents it from closing. According to the ACVS, of dogs that receive stents, 95% are immediately improved. The alternative option is an invasive surgery and involves attaching small C-shaped prosthetic rings to the outside of the windpipe. These do the same job as the original cartilage rings, but Tappan, 2016, suggests that complications associated with these are frequent. Neither method, though, is standalone. They work best with all the other treatments. How can you prevent a collapsing trachea? Although you can't prevent the gradual deterioration of the cartilage itself, there is good news. You can do many simple things to delay its onset and reduce the severity of the symptoms. Many are simple practices that are more choices of care than changes to care, and all dog owners could do well to follow suit. Preventing your dog from being overweight can have an incredibly beneficial effect on your dog's health in more ways than just this. Ideally, your dog should be slightly underweight anyway, and feeding a sensible, healthy diet can stave off so many health conditions associated with a collapsed trachea. Obesity, heart disease, lung disease, gum disease, and fitness level are all indicated in this condition, and targeted as part of recovery. Other triggers for symptoms include your environment, and living with smokers is certainly something discussed by vets as being a considerable influencer. Similarly, over-perfumed rooms, dusty or very dry environments, hot and humid or very cold conditions can all affect breathing. Learning more about what triggers your specific dog can really help you to improve conditions for them and extend their lives. Also, using a harness instead of a collar can prevent external pressure on their sensitive neck too. Proper handling of your dog by the whole family, and proper training to heel, are also beneficial. It isn't just internal changes that can reduce symptoms. A collapsed trachea isn't an easy ride once diagnosed, and breeders are working hard to reduce the instance of this condition in their lines. However, simply working closely with your veterinarian and family to keep your dogs in top health can be enough to delay the onset of this potentially life-changing condition. And the longer they are healthier, your lives together will be more enjoyable for you both.
If you enjoyed this video, nudge the like button. If you would like to see more like this, consider subscribing. If you would like to read the blog or check out my new book, I'm going to leave links to them in the description. Thank you for watching.